First, we want to make sure that you are a chiropractic client. Chiropractic is the thing that you need to do to fix what's going on with you at that time. Then what we're going to do is match what type of patient you are. There really is 3 types of patients, okay? So some patients come to us and they just want a little pain relief, so they hurt themselves in the yard, they sit at a desk all day, and all of a sudden they try to play soccer, and now their low back is bothering them, their knees bothering them. Okay, so we can do a temporary alignment to help relieve some discomfort. And really, you're a pain patient. You're going to come in when things are bothering you, and you don't want to come in and do a wellness thing. And some patients had that experience where they went to a chiropractic office and they would only make them do this whole plan and this big extensive thing. Okay, we will never take our health goals and what we would do and push it onto you, because some offices do that. The next thing you'll experience, and the next type of patient there is a biomechanical patient. Okay, patients come into me all the time and say, I went to my doctor, and you know what he did? He gave me pills. Okay, well, of course he did. Okay, that's what doctors do. They want to relieve your pain. That's what makes them great. Okay, so that might not have been the solution for you. So my biomechanical patients want to know how it happened. They want to know, what position do they sleep in, and how do you do exercises correctly, and when do you do them, with what posture do you do them? So with our biomechanical patients, we will get you on the minimal program, the least amount of visits you need to get back on track so that you don't keep having the problem over and over again. That's definitely a biomechanical patient, okay? And we kind of call that the medium health road. And then we have our wellness patients. So that's primarily the majority of my practice, where my patients have been with me a really long time, and they know if they get their checkups, just like you brush your teeth, you don't get cavities, okay? So bone spurs, osteoarthritis, degeneration, pulled muscles, inflammation are all side effects from going through life crooked, okay? Your car can't do it, you can't do it. Number one thing I hear, I never needed a chiropractor before. I'm sorry, but if you have a spine, you need a chiropractor, and most of those people are 20, 30 years late. So my wellness patients, they understand this. I don't need to have that conversation with them. That's a pain patient conversation where we have to kind of teach you what pain means again. So our wellness patients, we have amazing packages for you where it makes the adjustment very reasonable. And an adjustment. Let's talk about it. What is an adjustment? Okay, if you've never been a chiropractic patient before, or even better, if you've been to many offices and have been disappointed, I love my skeptics. They're my favorite patients because you guys are smart and you're really thinking this stuff through, and you're going to make the doctors really have good answers for you. Those are my favorite patients. So listen, in my office, what an adjustment is we go through every single bone in your body. Yes, all of them, hundreds. And all joints move 8 directions. They flex forward, they flex back, they bend to the side, they bend to the other side, and then they twist, and then they twist to the other side, and then there's traction. All of those movements are absolutely necessary for each joint. Now, we sit primarily when we're kids for the first 18 years of our life. Our skeleton is immature, and it is mature around 18, 19, 20. So what happens is we mold into a chair, and that becomes a pretty serious issue for people because there's certain joints you don't use and they lock up, like a locked door. So an adjustment is us being a detective going through the spine, looking very carefully at everything that's going on, and finding the joints that are locked up so we can get in there and get them moving again. So if a joint isn't moving in flexion, we adjust it in flexion. If it's not bending, we adjust it bending. If it's not bending the other way, we may have to adjust a joint 3 different directions. So for those of you that have been to a chiropractor and they got one pop and walked away, that's just not going to cut it, right? Because if a joint is locked in all 8 directions, then we're going to need to adjust it in all 8 directions. This is very, very, very important. Now, what about where you hurt? This is controversial. So some chiropractors believe in adjusting the sore segment. Most of the time when a joint is bothering you, and the body is inflamed, it's because a tissue has been torn. And adjusting through torn tissue is people's number one skeptical reason not to go to a chiropractor. Is also the reason why fellow doctors and orthopedic surgeons have heard that people have been more sore after they're adjusting, because we are not here to rip a scab off, to stretch a hypermobile joint.